Now we move on to the next segment, and this is the segment on mental health. Now, until now, we have talked about various kinds of diseases, some of which are communicable diseases and some of which are non-communicable diseases. But all these are diseases which are related to our physical health. Now, what happens is that when we talk about health in general, our health, the meaning of health for us is physical fitness or physical health or having a physically healthy living lifestyle. But one crucial aspect that we have been missing out for a very long time, and perhaps only last couple of years or last maybe 5 years, we have started to think over this perspective, and that is maintaining mental health. And especially during the times of COVID, the issues related to mental health also started to come to the fore, and people started to understand what mental health issues could be. Now, when we talk about mental health, it is basically something that has to be maintained, and it is a state of well-being for a person mentally. What do we define mental health as? A state of well-being in which every individual can realize his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. This is a definition that has been given by WHO. According to WHO, this is what mental health is. That it is a state of well-being in an individual where they can realize their potential, they can work for the society and the community, they can deal with the normal stresses of life, and they can work productively and fruitfully. These are the 4 criteria that have been laid down by WHO in defining what mental health is. Absence of any one of these can be called as a mental health problem. And if, let's say, these mental health problems persist for a long time or they become very difficult to handle, they can lead to mental health disorder. So there are many types of mental health disorders that a person may go through. Now, this is where the things become very crucial. If, for example, a person had a physical disease, what do? We seek the help of a doctor, we try to take a medicine, and we try to make sure that we are cured of that disease, or at least we take preventive measures against that disease so that we don't catch the disease. And this is true for probably every physical form of disease. But the problem is that we do not think of mental health in a similar manner. Mental health for many of us also becomes a taboo topic that we don't want to discuss, and perhaps we see somebody with a mental disorder as somebody who's mad. And because of these kind of stigma which are associated with mental health disorders or mental health problems, a person does not try to seek health, does not try to take medication, does not try to go to a doctor, a psychiatrist, or whoever can help that person to come out of that state of mental illness. So because of these factors, what we see is that mental illness or mental disorders or mental problems, whatever it may be, is something that we choose to ignore, or probably we choose to keep in ourselves. And we do not try to seek help, we do not try to seek prevention or a cure or a treatment against this mental disorder. And this is where it needs to be dealt with. This is how it needs to be dealt with, that we need to take help whenever we see something like this. It's not only important for our own well-being, but it's also important for us to understand if there is somebody in our surrounding, maybe a friend, maybe a family member, maybe a sibling, or maybe a co-worker. But it becomes very, very important for us to also identify if we could see something like that. If we see somebody struggling with the normal daily routines of life, we need to understand that this could be a symptom. It could be a symptom which may lead to a mental health issue in a given individual. So it's not only important for us to maintain our own mental well-being, but at the same time also be observant of the people who are close to us, people who we care about, that they should not be going through a problem. And if they are, we should be always available to them for any kind of help or any kind of assistance that they might need from us. Now, if we try to understand what are the reasons behind increasing number of cases of mental health problems, it all again comes down to the lifestyle. In most of the cases, it comes down to the lifestyle. So, for example, when we look at the lifestyle patterns today, It's very different from what it used to be maybe 20 years, 30 years, or 40 years back in India. So the lack of physical activities that we see today, the increasing amount of intoxication, whether it is about tobacco or alcoholism or drug use, all these are also associated with mental health issues. Then social stigma or discrimination can also lead to it. Not treating people well, not understanding their state, not understanding their problems, all these kind of things can also lead to it. And if they are suffering from some kind of issue or the other from the society, from their workplace, from their personal life, all these things can also lead to mental health problems. Then one of the key reasons that have come up in many of the surveys that have been done has been the career driven mindset and lack of empathy towards personal relationships. These are also some of the things that have led to increasing number of cases of mental health issues. Then smartphones, and with smartphones, social media. This also has led to increasing number of mental health issues. We have seen that with increased use of social media and increased use of smartphones, what has been observed is that a person's interest in socializing or communicating with people in the real world has also started to decrease. And with that, many of the issues also start to creep in over a period of time. So that's why we have seen that there is a direct relationship between the use of smartphones and the use of social media and the increase in mental health issues in people. And generally, when you look at the mental health issues that have started to creep in into the teenagers or young adults, this has been one of the leading causes as well. And then there are demographic determinants as well. So whether it is a cultural issue, a societal issue, or anything related to that, all these issues, even we have seen that environmental problems also have led to mental problems or mental health issues in many of the people. So that's why all these have been seen as reasons for increasing number of cases of mental health issues. Now let's try to understand what are these different kinds of mental health issues that we are talking about. First is depression. What is the meaning of depression? Depression is something that is characterized by persistently depressed mood or loss of interest in activities, causing significant impairment in daily life. Now, in the state of depression, what would be observed normally is that the person who is dealing with or suffering from depression, they perhaps will not be able to carry out their day to day activities in a normal manner. They may not be able to work, they may not be able to interact well, they may not be interested in any day to day activity, whether personal or professional. Apart from that, there will be a low, sad kind of state that will be maintained by the person for a very long time. Many of the cases, it is not even something related to an event that may have happened. That many a times, somebody's depressive state is also misunderstood as sadness. But there is a difference between sadness and being depressed. Sadness is something that may be strongly related to a cause and may go away in a day or maybe 2 days or 5 days. But a depressed state may not go in just 5 days of time or maybe even a month's time. It may remain there with the person for a very long duration of time. So that's why it becomes very, very important for people to understand that there is a difference between being sad and being depressed. That being depressed may go on for now. Sadness is something that may be many a times related to a cause. For example, let's say Indian cricket team loses a match today. So you might not like it. I would not perhaps like it, and maybe I would be sad, you would be sad for some time. But as soon as India wins the next match, we are all back to the same state, being happy about the fact that India is winning. But in depression, this might not happen. Many a times it may not be even related to a cause. So the person may remain in a depressed state for a very long duration of time without even having a cause and without specifically knowing that, okay, this is the reason why I am depressed. So that's why understanding this depressive tendency becomes very, very important for the people who are living in the vicinity of people who are in the depressed state. And understanding them, interacting with them, helping them out also becomes our duty in a manner. Then after that, you have anxiety. In case of anxiety, again, feelings of worry, anxiety, or fear that are strong enough to interfere with one's daily activities. So in anxiety, what may happen is a fearful situation or many anxious situation may be there with the person, which may even lead to some kind of even physical disorders. Like a person may get a fever just because the person is anxious or going through the state of anxiety. So that's why this again becomes a mental health issue with many people who become anxious and may not be able to perform well when they are anxious, when they are in an anxious state. Then after that, you have bipolar disorder, which are associated with episodes of mood swings ranging from depressive lows to maniac highs. That there will be different kinds of moods that the person would be in. Sometimes feeling very overly joyous, very happy, and in a very excited state. At the same time, there will be episodes of being low, being down, being sad, and these are things which may happen in extremes in the person who is suffering from bipolar disorder. Now, in many cases, what has also been observed is that bipolar disorders are not only related to the issues that we discussed, but sometimes bipolar disorders are also genetic in nature. There have been cases where it has been seen that if a parent has been diagnosed with bipolar disorder, there are chances that children of that person may also be diagnosed with bipolar disorder. So that's why in certain cases it has to be seen as being genetic in nature. Then after that you have dementia. In case of dementia, a group of thinking and social symptoms that interfere with daily functioning, and that's why a person may forget about daily routine, forget about many things, and may not even remember personal relationships at all. So this is what happens in dementia. Then you have schizophrenia. In schizophrenia, a disorder that affects a person's ability to think, feel, or behave clearly, and many a times we may see that the person is thinking in a different direction, is hallucinated, and simply in a state which is very very different from their normal state. They have a completely different, you can say, personality when they are suffering from schizophrenia. And then you have obsessive compulsive disorder, or OCD. So in case of OCD, there are extreme thoughts or obsessions that lead to repetitive behaviors or compulsions, that a person may become obsessed about something. And this obsession is not a normal obsession where you try to work towards it or try to work for it, but this is an obsession which becomes a kind of a disorder, a mental problem, and the person needs to get out of it. And it could be very small simple things of life which the person could get obsessed with. So this also is a kind of mental health issue for that particular person. Now, talking about the different kinds of measures that we can take to counter mental health issues, first of all, social stigmas should be reduced around such problems. We need to openly talk about these problems, communicate about these problems, understand these problems, and also make sure that people around us also understand these problems. At the same time, to keep alcohol use to minimum and avoiding drugs. This also becomes very, very important. Any form of intoxication, any form of intoxication can be very very bad for mental health of a person, and especially for example in case of alcoholism or in case of drug abuse. These are things where people generally think that they probably can take it to come out of a sad state or come out of a depressive state, but that doesn't happen. Maybe momentarily it will happen, but over a period of time they are very very harmful for the mental health and well-being of a person. So that's why people may tell you about these, this and that, and this being good and that being good in a certain state, but in most of the cases they are not. It may be good at that moment, it may feel good at that particular moment, but it's not something that is going to be good for the mental health in the long run. And the problems may start to intensify and multiply after a point in time, after a person is in a habit of intoxication altogether. So that's why these are things which have to be avoided in the daily lives. Then, to maintain a healthy lifestyle, whether it's about social interactions, whether it is about physical health, whether it is about maintaining a balanced diet, whether it is about exercising or doing yoga on a daily basis. So these are things which can be done by a person to make sure that they can maintain a healthy state of mind, not only a healthy body. Then individual awareness about mental health, understanding mental health issues, understanding your own issues, if not at least others' issues, and then reducing the treatment gap if at all treatment has been recommended. If somebody has been told to take medication, for example, they should take the medication, they should go through the treatment and try to come out of the state of mental disorders. Then, apart from that, proper training to people who are handling such patients, whether it's about psychiatrist or any healthcare worker who is associated with mental health issues, they should have proper knowledge and proper understanding of anything that can be related to a mental health problem. So their awareness also would add to the awareness of the society in general, and not only for the patients but also for the relatives and friends and family of the patients also. This will be very, very helpful. And then government policies to facilitate such practices is also very, very important. So that's why all these are some of the steps that can be taken to counter mental health problems. Now, if you talk about the government initiative, there is the National Mental Health Program that was launched by the government of India back in 1982. And since then, there are various programs and policies that have been taken as a part of this umbrella program, that is National Mental Health Program. So what is being tried as a part of the program is the prevention and promotion of positive mental health, treatment of the mentally ill, and rehabilitation facilities to be provided for people who are suffering with mental health issues. Then, apart from that, there are two additions that were done to the National Mental Health Program. Now, there is one addition that was done to National Mental Health Program back in 1996, and this was District Mental Health Program. So, its objective basically is to provide community mental health services at the primary healthcare level. So, providing psychiatrists, providing counselors who can help the people who are facing these kind of problems, so that people have somebody to talk to if these kind of issues are something which is being noticed in a given individual. So, to provide sustainable basic mental health services to the community and to integrate these services with other health services as well. So, that's why, as I said, that when you talk about a healthy being is not only a physical well-being, but at the same time it is also about somebody's mental health being. Both the things come together, both the things have to be taken together to understand what health means and understand what being healthy means. It's not only about being physically healthy but also being mentally healthy. So this brings us to the end of the portion where we are talking about mental health issues. So until now we have discussed about all the physical health issues, all the communicable diseases, as well as non-communicable diseases. And then after that, we have discussed about mental health and some of the issues related to mental health and the areas to cover with regards to mental health. Now, with regards to mental health specifically, I would ask you to understand these issues better, not only for your well-being, but also for the examination. Because in the COVID times, we have seen that mental health issues have started to surface much more than they used to. The world has seen a completely different scenario, something that nobody of us thought that we would have to see in our lifetime, but unfortunately we have had. And because of that, we have seen that the mental health issues also have been on the rise. So that's why there are possibilities from examination perspective also, that these are the kinds of issues that will be taken up in the examination also. So all the programs and policies, everything that is being done in the sector of mental health, whatever nationally or internationally is being done, all these things you should keep on following for your examination as well. All right. So this brings us to the end of this particular segment.